So our next speaker is Niraj Baheti, who is also a physical therapist here at our Walnut Creek Clinic, and you will recognize him from the Motion Lab workshop. He's a senior PT with UCSF Benioff Children's Hospitals. He strives to be at the forefront of emerging technologies and has followed closely the advancements in AI and its impact on healthcare. He's also worked with our U.S. Olympic athletes and has been published in national journals, has written book chapters, and has edited a physical therapy book. Niraj has also been awarded the esteemed Kevin Wilk Traveling Fellowship. He has presented at multiple regional, national, and international level conferences and serves as the program director for the UCSF Benioff Children's Hospital Sports Physical Therapy Residency Program.
All right, thanks, Ram. I see there's only some of you have made it through Saturday late talk over here. So I was gonna not use the mic and see if you guys want to just stand up, just move up a little bit closer. But if you guys are fine where you are, we can just stay there, okay? Give you guys a second, anybody wants to move, it's fine. All right, so I just wanted to thank, again, everybody for being here. Thank the organizers for allowing me to present on this talk. It's a kind of an off topic, honestly. Most of the, obviously have been around patient healthcare and stuff. But I'm going to talk about AI and how it's really transforming healthcare. There are many aspects of healthcare that AI is touching. There could be operations, there could be what's called revenue cycle management. I'm not going to talk about any of that stuff. I'm just going to really keep focus on patient care itself. Me being a physical therapist, the talk is slightly biased towards some more physical therapy side of things. So I just wanted to give that heads up as well. I do have a disclosure. I work for a company called Atelus that does AI operations in healthcare. But having said that, I'm going to mention a variety of products and companies today. Here is just the nature of the topic, that AI is being something, it's not something that necessarily developed in academic places. It's startups and companies that are focused on leading this whole realm. And so, but my goal here is just really to introduce you guys to what's out there today. And I'm not promoting or endorsing any one of them. If you choose to use any of those tools, make sure you do your research around it, look into it, make sure it fits the needs, your needs for your practice. So just keep that in mind. Before I start, I just wanted to get a sense of who's here in the room. How many of us are like clinicians here? I see a whole bunch of hands go up. How many are in like academics? Like faculty? I see a couple, 3 hands go up here. How many students? Are there any students left? Okay. All right, we got a few students. How many here just for the CEUs? I see a bunch of hands go up there, including my boss. All right, I'm not going to go over the learning objectives, but just in general, I don't know if you guys have noticed, AI is truly here in very absolute sense of it. Except that AI has been around for a very long time. The word itself was coined back in 1950s, artificial intelligence, and even going back to 1997, where IBM's supercomputer Deep Blue defeated Garry Kasparov, their grandmaster, but that was all the way back in 1997. So this is 2025. Why are we talking about AI now for something that's been around for so long? Well, something happened on November 30th, 2022. Who can tell me what that was? Just real quick. Or just shout out your answer. Anybody? ChatGPT. Thank you. It's also in the slides, so maybe somebody saw it. But yeah, ChatGPT was introduced, and in fact, the world was introduced to what's called generative AI. And that day, the world single-handedly, that is a single moment that world changed, similar to introduction of the personal computers, the iPhones coming out in 2007. This moment is even bigger. And that's why this tweet by Sam Altman, OpenAI, who's the founder of ChatGPT, is a very iconic tweet that people talk about. Just in last October, they were funded with $6.6 billion of venture capitalist fund, which is absolutely unheard of No other company has ever been given so much money at such an early stage of their life cycle. But turns out that since deep research was introduced by the Chinese, turns out it can be done for a lot cheaper than what they needed the money for. So, a lot of interesting things coming up over there. Anybody in this room has used AI for generating images using like text or word? I see a few hands go up. There you go, some more hands, don't be shy. This is Midjourney. That's really the leader in image generation using textual prompts or verbal prompts. And this is Harry Potter. You can't tell really from back here in February 2022, but in just over in 18 months or so, the same prompt went from generating this, what looks like an amoeba to me, all the way to what generally is recognizable as Harry Potter. And that time span is very short for just giving words to generate an image completely using computer technology. It's pretty mind-boggling. Let's look at this over here. This is humans versus AI. Stanford's Human-Centered Artificial Intelligence Institute or something like that publishes a report on AI every year. In 2024, it was the largest report ever. It was 502 pages. And in preparation of this talk, I read the entire 2 pages of it, okay? Just the summary, that's all I did. But let's take a look at what is shown over here, right? So AI, so this is where the human baseline is, the 100%, right? AI has already taken over, has actually surpassed humans in many things like image classification, just visual reasoning, basic reading comprehension, and several others. The thing to keep in mind over here is this is a timeline on the x-axis. A lot of this initial curves, slopes back in 2012 or even 2017, a lot of them are like going up very, the slope is very low. But technologies that are coming back out in 2021, look at the slope on that line. That's almost vertical. AI is really, it's in toddler phases where it's not that it's making progress, it's making progress at an extremely, extremely rapid pace. And to the point that some of the experts are actually rewriting the tests themselves of what is considered human baseline and what it takes for computers to overtake them. Okay. This is just a sort of supposed to be like an overall hierarchy and glossary of terms. I'm not going to go over every single term used in AI, but it's in your handout. I am going to talk just really briefly about physical therapists and AI. What some of the research shows is that PT's knowledge about AI in rehab itself is less than their overall knowledge about AI. PTs who work in non-academic sectors tend to have more positive attitudes towards using AI. So sorry about some of my faculty folks who raised their hands. PTs who have less than 10 years of experience also tend to have more positive experience. So sorry about older physical therapists. Research shows you don't have positive attitudes or AI. It's not me. Talking about curriculum in PT schools and med schools, turns out med schools are doing a lot better job about including AI in their curriculum compared to folks in physical therapy. Similarly, the next bullet, again, much more it has been published about using AI in their medical, not just the school curriculum as well, but just post-residency, all those areas as well. In fact, one of the research studies, I did this search myself for like PubMed and Medline late last year, looking for AI in physical therapy education. There were no findings at all. There is no studies based upon that. So I think PTs in general have a lot of work to do over there. Let's talk about just again some applications of AI in healthcare overall, starting with using it for virtual and real-time assessments. This really a lot of money was put into this industry since the pandemic because everybody went remote. So that is sort of the timing has helped out with that as well. But it's been pretty amazing what using virtual care, using AI has allowed patients to access care sort of remotely, right? Like not everybody lives in a big city or like a suburb area like that. There are a lot of folks living in the rural areas or folks who are not able to get to hospital. So that's been great, like using wearable technologies. I mean, they make wearable technologies for everything. They have chest straps, they have watches, they have posture shirts, they have knee sleeves. I was talking to a founder the other day who was developing a knee sleeve with all bunch of sensors, remote management, and just be able to track their patients without even being present with them. And it's all real time, having constant monitoring. A lot of these are sort of cost-effective solutions as well. And so I know I was talking to some of the folks from Canada here. I don't know if they're still there or not, but they're saying how it's hard to get ortho folks into their clinics and really provide sufficient quality of care. But a lot of these options could be good for them as well. What AI allows you to do is really use data-driven customization. What that means is AI is able to look at, let's say at the initial intake, you have your pain levels, you have outcome measures, you have severity of injury, you have your age, gender, all those demographics. Well, it can look at existing data, and based upon all those parameters, what are the treatment plan? It can come up with a treatment plan for you. It can help with insurance in terms of how many sessions for rehab is it going to take for someone with these specific data points to get better. So it's able to customize your rehab plan based upon that, right? Not just that, it's able to predict how many sessions you think it's going to take. How long is it going to take for someone to recover from these ailments? And like I said, allowing for sort of all of this to be happening remotely without having to see the patient at all times. I want to talk about this one company called Sword Health. They're doing really great work in rehab space. And they offer all types of sort of musculoskeletal, chronic care, all done virtually using AI, where you use your phone, just your regular phone, and the therapist is able to do your assessments, come with rehab plans without ever having to just even really go to the clinic if you didn't have to. They're also developing, on the bottom right, you see this device called Bloom. It's FDA approved, and it's great for pelvic floor rehab as well. And for postpartum care, it's been shown to be very successful as well. But again, using all these tools, virtual tools, along with AI to kind of make really new inroads in how healthcare is provided. Just really going away from traditional methods, and there are companies out there who are doing really good work there. Improving patient engagement. Again, I know we all use chatbots and to do like customer service type of stuff, but this is next level stuff. I mean, this is not just a script that if you ask a certain question, it has a script in it, it's going to respond to that. No, it's able to actually listen and extrapolate that information as a human being. It's not quite there yet, but it's like I said, the trajectory is amazing, and it's able to answer questions. It's able to make like appointments, basic questioning. Now remember, at any point, it can forward that to a human if needed, but it's able to track symptoms between sessions. You can ask questions for anything. I know not just physical therapy, but for I know this one company called Memora Health. They are using it for pregnant women, right? They have a lot of questions sort of leading up to the delivery, and a lot of resources have to be spent in that. Well, chatbots they've shown are able to really answer a lot of their questions and alleviate a lot of that anxiety that can come from the delivery that's upon us, right? It again helps with improving patient compliance, and it just reduces the need for like constantly needing a healthcare professional to answer that every single question. Anybody here has used like VR goggles or things like that? Okay, you see a few hands go up there. They're amazing. If you haven't ever gotten your hands on one, try it. It's actually really cool. There are different layers. One is like virtual reality, which is like completely immersive environment where you're completely transported somewhere else, or augmented reality where you could still be in this room, but there are certain characters and our avatars have been sort of created in this space itself. So that's more like augmented reality. But that is used a lot right now. A lot of money being invested in that as well. This company called Emergo Labs, the founders was out of UC Santa Barbara, has done some amazing work in terms of just really making rehab or any type of healthcare accessible for folks who are not quite able to always go to your patient, to your doctors, right? And there's one more slide over there I can talk about where surprisingly older folks have taken to this, which doesn't like on its face value make sense, but because you would think there'd be so many technological challenges, but once they're trained on using a VR tool, they are actually, and neurological patients, those are the two categories where they are really able to, from their home itself, get consistent care and have demonstrated significant improvement from there. But they do need to be trained on it first. Again, like I said, there's a few companies, Emergo Labs, Mind Maze, who are doing some cool stuff there. Any runners in the group here? Yep. Okay, a couple runners. You guys should look into Microsoft HoloLens. It's literally like a ghost pacer for you. So you wear these goggles on, and there's a ghost pacer you can who could help you through your run. Okay, it's like augmented reality. It just creates on the ground, on the track, and you now have a friend, to run with. So pretty cool. All right, I'm just going to throw a bunch of names on this slide here. A lot of these folks are pretty much rehab focused, but again, they are doing everything from offering virtual therapy program, wearable sensors, real-time feedback, and like I said earlier, there's a lot of folks out there and a lot of investment in this field, and it is essentially gradually coming mainstream. Okay. Personal experience. That is Megan. That she's an AI. Anybody seen Megan over here? Nobody. Okay. She is scary. It's like the modern Chucky. Okay. In this case, she's giving a personalized experience to her neighbor. Never mind. All right. Okay, virtual reality. Why do people use VR? Okay, there are insurance companies paying for VR therapy right now. Why is that? Because for two reasons. First of all, they've shown really good outcomes. Like I said earlier, in older population and folks with neurological conditions. Secondly, it's just really fun to play games. I mean, no matter who you are, what age you are at, it is really fun to play games. And VR is all about just playing games. It's just basic silly things you do in there, but you're actually getting, treated, right? So that's why it's been pretty successful. Obviously, it does have some challenges over here. It's mentioned just ease of use and space and some barriers around there. But if you can address those, it actually is pretty helpful. Patient engagement. This is my personal favorite slide. Any pediatric therapists here, okay, or clinicians, it doesn't matter. So you can use image generation. All the images I'm going to show, in fact, most of the images in here are all AI generated that I've had. But you could demonstrate squats to your patients, or you could have Spider-Man do that for you. Okay. This literally took like 5 seconds to build this. Okay, super fun. You could demonstrate single leg exercises or have Moana do that for you. Okay, kids love this stuff. And my personal favorite is Chase doing push-ups. Okay. All right, next slide. Okay. All right, this is where things start to get a little bit scary, I would say, where an AI is leading an entire physical therapy rehab session, like entirely on their own, okay? It is amazing as a nerd to see that technology can do that, but as a physical therapist who's scared of my job, I'm like, oh my God, what's gonna happen to my job, right? But it is independent, completely it's able to process this all on computer or your phone, completely able to listen, like process natural language. It's able to make recommendations. It is empathetic. It is able to progress your treatment plan, do an entire evaluation without ever needing a human to be involved in the loop. The company that is doing this, it does say that all these reports are forwarded to a physical therapist, but a physical therapist using this technology is able to manage about 800 to 1,000 patients single-handedly. So while there are downsides to it, but like, oh my God, what's going to happen to my job? Think about patients who now that one person is able to provide care to 800 or 1,000 patients. I don't think I can do that personally, but using AI, it does improve access to patient care. So something to think about. All right, big data, okay, I know I'm coming up on time here. I'll try to go fast. Okay, big data is, again, something, slides look off. Okay, again, all the data, again, healthcare industry, on a daily basis, we are generating billions of data points every single day. Well, guess what happened? All of that is utilized, absolutely. Company called TriNetX, they've been working with Epic since 2007. All Epic data on a daily basis is de-identified as in backed up in a place. Other companies are also doing this, and they use this data for a variety of reasons, for real-world evidence generation, reducing disease burden, comparing effectiveness of different treatment, identifying patients for clinical trials, all kinds of stuff. Physical therapy data, on the other hand, is lagging behind, is because physical therapists don't use discrete data. What I mean is, we like to really free type everything in, okay? And instead of using checkboxes or drop downs, those are easy to process and evaluate those later. Free text, it's possible, but it's harder to do. So I do recommend PTs start to use some of that so we can have more analytics that can be gotten out of our data as well. Computer vision, again, as the name suggests, is computer with eyes. Okay, literally, it can be used for deep. Here is a drop jump test, something we do in the motion lab. At some point, I had hopes and dreams of using IBM Watson for using computer vision for predictive analysis of a drop jump test, where I would literally feed it, and we have it right now, someone can do it. We have thousands of data points of drop jump tests. We just feed it into a computer vision program, and then you just record a new patient who we've never seen, and it can look at existing data points and tell you if you're at high risk, moderate risk, or low risk of having an ACL injury. So it is entirely possible to do. We just don't have the time for it. I'm going to skip this one. I'm just going to talk about a couple slides here real quick. Again, using AI for patient monitoring and triage. Kaiser is doing some amazing, any Kaiser folks here? Yeah, okay, good, a lot of yeah. Kaiser is doing some really cool stuff. I mean, I have Kaiser myself. You may love or hate them, but what they're doing on terms of digital and in technology space is pretty mind-blowing what they're able to do. So they use AI right now for advanced alerting system in hospital, where instead of traditionally a nurse trying to monitor all the patients, look at all the vitals and data points, an AI is able to constantly monitor thousands of patients at any given time and alert that to the appropriate clinician as needed. And they've been, so that you can get the help to that patient as possible. Similarly, there's another company called Muse AI. They're doing something similar more in a hospice space as well. Clinical documentation. Anybody use like any scribing tools, ambient scribing tools? All right, some of the Kaiser folks are putting their hands up again. You're right, Kaiser is using, well, what do you guys use there? A bridge, okay. A bridge, yeah, it's on there, yes, perfect, good. So yeah, there are several companies out there who are doing ambient scribing. It is absolutely fascinating what it can do. So there are folks out there who are like, oh, I'm more old school, I don't want to use this, I don't want to hear it, okay? It is absolutely amazing. You can, I don't know if you can see that here, it's actually not in the notes, I just put this on today. But it can create an absolute customized note for you. It learns over time how you document. This is a session I did. I went and met a dermatologist the other day, and she wouldn't believe it. She like, there's no way, yeah, I can do this. We did this whole physical exam here, and she did not type a single word. This is all she and I were talking to each other, and this soap note was generated, and she was astonished how accurate it was. So nowadays we're like, oh, should we use Scribe or not use Scribe? Fast forward 5 years from now, everybody's going to be using it. It is absolutely amazing. If you haven't used it, please use it. Okay, I'm going to skip this one. Ethical considerations. I just want to kind of quickly hit a couple points about it. Again, people have concerns about ethics of using AI in terms of patient privacy, data privacy, patient autonomy, but those are absolutely fair to have that. But hopefully, that this is where we rely on some of the institutions themselves, like Kaiser, who are sort of not government related, but also hopefully governments are doing some of their role here in terms of making sure while we do innovate and continue to improve patient access to patient care, we're also being aware of data privacy, so especially things like wearables. Like, is the data secure? Can somebody get my information and whatnot? So those things absolutely need to be considered and addressed. Same thing, patient autonomy. Like if the AI is suggesting, oh, this is your plan of care, how much input does the patient have in that? So you got to make sure you always involve patient in any of the clinical decision making and plan of cares. Algorithmic bias. A lot of these AI models do have bias in there, where maybe folks from poor socioeconomic status or diversity aspects are not fairly represented in these models. So you want to make sure that we are addressing that as well. This slide, I had to rewrite this slide because like back in October 2024, when I did a similar talk, it was all about U.S. and the Europe governments. They're all trying to increase regulations on AI. Well, the new administration came and everything changed, right? So just recently, UK and US refused to sign the International Declaration on AI. And so things can change very rapidly. They don't want to stifle AI and just let it loose. Again, that is so that because they are concerned about innovation being stifled. So it depends who's in power, so they have a lot of say in what happens, right? And that's Megan again here. In conclusion, again, so remember, if back in 1995, you're like, hey, I don't want to use computers, that's fine. You could just be a clinician and go about your day, not ever needing to use a computer. But in 2005, you're like, you could maybe still go about doing your job without using computers, but if you knew computers, hey, that's pretty cool. Actually makes you more marketable. Now, 2015, you don't want to use computers where you're out of a job, okay? This is where we are with AI. It is here, so I highly encourage that everybody utilize it, and that's kind of my conclusion over here. Get comfortable with it, use it, be part of the process. Don't sit on the sidelines. The more you use it, you get to use your voice. You get to be part of the process. So don't let somebody else make those decisions for you. Start with one use of AI. It could be for whatever. You could use ChatGPT. That's the easiest way to do it. But use it at your work. If your work doesn't have it, ask your bosses, like, hey, what can we do using newer tools? Again, with keeping in mind that you're trying to improve patient care, you're trying to make your job easier, all that good stuff. Otherwise, and again, job security, that's the other one. I don't think AI in itself will take your job, but someone who knows more about AI could potentially take your job. Generative AI, I talk about this all the time. Again, using ChatGPT, okay? The responses you get from any generative AI are only as good as the prompts that you give it, okay? So if a high school kid is asking a certain question about low back pain, the responses they get are going to be different from a OCS or a sort of board certified clinician that they are asking similar questions. The responses you're going to get are different. So keep that in mind, that don't just feel like, oh, now everybody has access to it, but it's only as good as who is asking the question for it. And this is really like my final sort of, finishing top point here is you have human intelligence and you have artificial intelligence, and you want to find that sweet spot in between where you're using both of them. And that's it.